Well, hello. I am really excited. One of our newest Life Co-Pilot members is Colleen Rusnak, and Colleen is with Indiana Health Fund. And I honestly don't remember who turned me on to you, Colleen, about what you guys do, but it's really cool. It's something that I didn't even have any ideas anyone did such a thing. So would you explain to us who you guys are and what you do and all that kind of good stuff?
Sure. Yeah. Thank you, Jim. And I appreciate you taking time to learn more about Indiana Health Fund today. And Indiana Health Fund is a nonprofit organization. We are focused on helping people with medical debt and medical bills. We specifically want to help those people that are 2 to 4 times above the federal poverty level. They might have debt that is 5% greater than their annual income or debt outweighing their assets, and they are in a financial hardship and facing medical bankruptcy. Indiana Health Fund was started by 2 physicians, Dr. Jeffrey and Dr. Lee Meltzer. Both are OBGYNs, and they really saw that there was a need for that people had a gap in access to affordable health care. So people might qualify for Medicaid, but you have this group of people that's right between just above the poverty line. We're not quite on to Medicare yet, that have medical bills that they cannot afford to pay. So we've been very active. We're a newly formed organization, but we're very active on not only helping people with their medical bills and relieving that financial debt, but we're also focused on educating the community on everything related to medical bills, preventing medical debt, understanding your medical bill, understanding your explanation of benefits. Maybe you have insurance, but you have a high deductible plan, or you have insurance on exchange. And how does that all work? And then also, when you're working with medical bills, how can you work with the hospitals or your healthcare provider on some of the financial assistance and programs that are provided that not everyone knows about?
Well, excellent. One of the questions I'm going to have is what is kind of a number, if you can, what's like when you say above the poverty level, what kind of number is that?
So that's a great question. And so that might be a family of 4 that has an annual income of about $50,000 a year. So we do have resources. If someone has a question on whether or not they fit into that gap or would qualify, if they reach out directly to me, I can help them with that. We have a whole chart and other resources where people can find out if they would qualify.
So how does someone get a hold of you? How do they get a website? You got a phone number that'll be on the list here by your video as well. Mm-hmm. But what's the process like when someone is trying to figure out how to get help, and they get a hold of you guys?
And right now, the best way, if someone needs assistance, is they should just contact me directly. And I believe my email will be on the website.
It is.
Okay, great. So the first thing I would suggest someone to do is go right to the website and email me directly, or they can look on our website and it shows how we help. The second thing that we're adding this week is we're adding an application to the website. So probably by the time people would see this video, our application will be live. And if they can read through the qualifying factors to see if they do qualify for our assistance and complete the application. And then we go to our board of directors and we vote on who qualifies, who has the most need, and go about it that way. We do assist the entire state of Indiana. So anyone that lives in Indiana, that's the first qualifying factor. And then we go from there.
Excellent. So how are you getting your message out other than like we're, Life Co-Pilot? How are you getting the message out to people that you guys exist and a resource?
Yeah, and that's an excellent question. We've since we launched right at the start of the pandemic, it's been a little bit of a slow process. We have been building up our social media. We've had some articles posted in a few of the news outlets, and so we're continuing to focus on some of the PR pushes to get our message out. We've also partnered with several other nonprofit organizations that work in the healthcare space to help promote our message. And we've partnered with Community Health Network and IU Health to help when they have patients come forward. We are a referral for those patients. So we've been trying to get out the message as much as possible. And then we held one event. Our first event was in March. And so that'll be an annual event each year. And that was a kickoff to get our message out. And then we're continuing to do more of those now that COVID has sort of like, we've learned how to deal with it, I guess. We're doing some more in-person events. So I would say, yeah, follow us on social media, follow us on Twitter, follow us on Facebook, Instagram. And that sign up for our newsletter. You can sign up directly for our newsletter on our website, and get all of our information that we send that out monthly too.
Excellent. So what is your recommendation for someone that feels like they're in trouble? What do you know, and I know you have like an ongoing educational process. I know a lot of that stuff's going to be on Life's Copilot too. So, but tell us, what do I do if I'm just worried?
If you're just worried, and this is where I'm more than willing to talk to them, or we have volunteers that will help set up a phone call and a conversation. The first thing I would do is work with, I should say we largely work with the hospital systems, but it can be similar for some surgery centers and some other healthcare, depending on where your bill is coming from, if that makes sense. But the first thing to do is I would if you're working with the hospital, I would talk with their financial assistance department. That can be difficult to navigate. So that's something that we've been, we want to push out on our education platform, those resources. So if you're working with Ascension or community, where do you go to find those financial assistance programs? Legislation changed. It was just I believe in February, where now hospital systems, it used to be that patients only had 180 days to pay off their medical bill or set up a plan before it went into collections. Now, legislation has changed. So now patients do have a year before their bill will be sent into collections. Any bill that's $500 or less is supposed to be just wiped out. So the first thing I would do is I would get on some sort of assistance plan or speak with the hospital to make some sort of payment arrangement that you can afford before, so at least it's not sent into collections. And then at that point, looking at other resources, and that's something where they might want to contact our organization. We do work with a medical billing advocacy company, and it's Clearview Healthcare with Jenny Nolan. If someone comes to me and I make a referral, she will work with them at a very low discounted rate. So there's other resources out there. Obviously we're in the nonprofit space. We're here to help. That's our biggest mission. But there might be even some for-profit companies that can work at a discounted rate that can work as a medical billing advocate to help wipe out a bill.
So is there any charge to work with your services, or?
There's absolutely no charge to work with our services. We do not require anything. You don't have to make a testimonial on our behalf or anything like that. We just want to provide the service.
Excellent. Now, are you guys doing fundraising to help support you guys too, or how does that work?
Absolutely. And we actually have just had a very successful last few months of fundraising. We just were awarded a grant from Glick Philanthropies. So we're very excited about a lot of support we've received from the community. And so we're looking forward to really helping, people all over the state of Indiana that are suffering, that are, in financial hardship or facing medical bankruptcy due to their medical bills.
That's excellent. Well, now, when you're not working, what do you do? Tell me what your life is like. What do you like to do?
When I'm not working, I really love to walk. So actually, I apologize. Right before I jumped in this video, I did take a quick walk. So I'm sure I'm like a little sweaty, but no, yeah, I love to walk and be outside. And I travel to Colorado a lot because I have family there. My brother's there. My parents are there, retired there. My nieces and nephew. And my nieces and nephew were just in town. So I was having a good time chilling around Indianapolis and taking them around to different places and things like that in the fair. So yeah, be with family and be outside and walking is probably my favorite things to do.
That's excellent. Well, thank you so much for sharing with us. And hopefully people will be contacting you that need some help here real soon.
That'd be wonderful. Thank you, Jim. I really appreciate it.
Thank you.